Tantor Audio, a division of Recorded Books, presents Anxiety Relief for Kids, On-the-Spot Strategies to Help Your Child Overcome Worry, Panic, and Avoidance, by Bridget Flynn Walker, Ph.D. Foreword by Michael A. Tompkins, Ph.D. Narrated by Callie, Beaulieu. Publisher's Note: this audiobook includes bonus material. Please visit Tantor.com and type Anxiety Relief for Kids into the search box. Follow the link to the book's page, then, under the Supplemental Content section, please enter the access code CARE, and then click the Unlock button to access the bonus material. The code should be entered in all lowercase letters. All figures and tables referenced in this audiobook can be found in the bonus material. Foreword. 20 years ago, my wife and I arrived home from the hospital with our newborn daughter, Madeline. I turned off the car, and my wife and I sat for a few moments staring in wide-eyed awe at tiny and beautiful Madeline asleep in her car seat. I looked at my wife and, with a nervous smile, asked, "By the way, did they give you the operator's manual for the baby?" My wife looked at me with a nervous, yet less nervous smile. "No, I thought they gave the manual to you." This did not reassure me. When I think of that moment, I still think it was a bit crazy, or at least unwise, for the nurse to send us home with a newborn infant. I assume they believed we could figure the parenting thing out, as so many other parents have done, but still, it is unsettling when you think about it, right? Of course, most parents do figure it out, with the support of friends and family members. But what parent has not longed for an operator's manual to guide them at a critical moment in child rearing, particularly at those moments when their child is suffering? Over 25% of children and adolescents suffer with an anxiety disorder, making anxiety disorders the #1 mental health issue for youth. Behavioral science tells us that parents play a key role in assisting a child to recover from anxiety disorders and other mental health problems. And it makes intuitive sense, too. Parents are in a better position to observe, support, and intervene with their anxious child than any mental health professional. The anxious moments that occur in the lives of most children seldom occur in the therapist's office. They occur in the world in which the child lives: home, school, soccer field, play dates, and typically the parents live there too. So where is the operator's manual for parents who wish to help their child recover from an anxiety disorder? There are many books, or operator's manuals, if you will, on the topic of assisting over anxious children, but perhaps few are as clear and as thoughtful as this one. This book covers the basics of cognitive behavioral therapy, CBT, the psychological treatment of choice for over-anxious youth, and the author, Dr. Bridget Flynn Walker, is an expert in this approach. This book will guide you and your child through the process of recovering from an anxiety disorder. Like any operator's manual, this book covers the basics, such as educating you and your child about anxiety and anxiety disorders, identifying the triggers of your child's anxious response, setting the stage for exposure, and assisting your child in completing and benefiting from these important and essential exposures. Furthermore, although the research on pediatric anxiety disorders and their treatment is extensive and often rather dense for many parents, this book takes some of the most important topics and explains them in simple and straightforward language. Every operator's manual includes a troubleshooting section, and several chapters in this book include one too. In those sections, you will learn strategies to overcome the obstacles that typically arise when helping children face the things that frighten them. One last point. If, after applying the strategies described in this book, your child continues to suffer, it may be time to find a competent cognitive behavioral therapist who is knowledgeable about pediatric anxiety disorders and knows how to treat them. This book will help with that, too. Having listened to this book, you will be well prepared to talk with prospective therapists about cognitive behavioral therapy and ask them how they use it to treat their patients. Their answers will tell you who can and cannot help your anxious child. If your child is already meeting with a therapist for help with an anxiety disorder, using this book along with therapy can help your child tremendously. The exercises in this book, particularly the exposure exercises, will greatly supplement therapy sessions, and you and your child can discuss the results of the exercises with your child's therapist. If your child is not engaged in exposure in a systematic manner in therapy, then your child is not receiving CBT, and I would suggest finding another therapist. Many kids suffer with anxiety disorders, and many kids, through the strategies described in this book, recover from them. Informed, caring, and thoughtful parents play a crucial role in that recovery. Good luck to you as you undertake this important mission to help your child. Michael A. Tompkins, Ph.D. Author, My Anxious Mind, A Teen's Guide to Managing Anxiety and Panic. Co-Director, San Francisco Bay Area Center for Cognitive Therapy. Assistant Clinical Professor of Psychology, University of California, Berkeley, Oakland, California. November 20th, 2016. Introduction. As a parent, you can do a lot to help your anxious child. You can learn how to respond more constructively to your child's distress. You can better understand your child's anxious behaviors so you can make better choices for him. You can even learn how to actively help your child conquer her fears, so anxiety no longer creates so much distress and disruption for your child and family. With the program described in this book, you can apply the most up-to-date information scientists have regarding the effective treatment of anxiety problems. This book presents a program you can use to guide your child toward a happier, healthier life. By providing you with the information and practical tools you need, this easy-to-read primer will show you how to take a more active, constructive, and rewarding role in helping your child manage and, ultimately, overcome anxiety. Whether your child struggles with mild anxious reactions or more difficult anxiety disorders, you have the power to help. As you listen to this book, you will learn just how critical your role is in this process. As a clinical psychologist, I have specialized for over 15 years in using cognitive behavioral therapy, CBT, to successfully and rapidly treat children with anxiety disorders. CBT is a form of psychotherapy that focuses on changing thoughts and behaviors to alleviate emotional problems. Thousands of clinical trials have shown that this approach works, and ongoing research continues to make it even more effective. I have incorporated the latest findings in this book. CBT is most effective in alleviating the distressing impact of anxiety in children when parents are actively involved in the treatment process. My own hands-on experience has shown me how pivotal the parent's role is in treating a child's anxiety. In fact, I require parental involvement in each child's treatment because progress tends to be limited when parents are not involved. During the course of treatment, I teach parents about anxiety and how changes to their behavior can help their child. Getting treatment for your child can be difficult. Many parents have trouble finding a trained clinician in their area, especially one who is taking new patients. The cost of treatment can also be a burden. Fortunately, some studies have suggested that parents can use CBT on their own to help their children. For example, Kirsten Thirlwall and her colleagues in the United Kingdom found that children whose parents used a self-help book, along with some support from a CBT therapist, were 3 times more likely to recover than were children who received no treatment. Although a number of CBT manuals for children with anxiety disorders exist, most are put together in ways that make them difficult for a parent to use successfully. Some present more clinical information than is necessary, making them confusing and overwhelming to a lay person, and none are based in the most current understanding about how to use CBT to treat anxiety problems. Parents routinely ask me to recommend resources that are evidence-based, thorough yet concise, and user-friendly that they can use, especially with younger children. I have been hard-pressed to identify such a resource. With this in mind, I decided to write Anxiety Relief for Kids. In practical, straightforward terms, this book shows you how to share the proven methods of CBT with your child. This book will not tell you everything there is to know about anxiety disorders in children. That is not my intention, and it isn't necessary for your success. However, it will give you the most crucial information you need to help your child. Specifically, you will learn how your child's anxiety starts, how your child's anxiety grows, what makes your child's anxiety worse, what you can do to reduce your child's anxiety, how to make better decisions related to your child's anxiety, and how to respond more constructively to your anxious child. I have incorporated the views and experiences of parents into each chapter. The questions a typical parent or child might ask are addressed throughout, and each step is clearly explained so you and your child can feel empowered in the process of successfully managing and conquering anxiety. Easy-to-follow worksheets allow you and your child to work through the program in manageable stages. Blank copies of each worksheet are available online. I also include sample conversations that suggest how you might speak with your child at each step. As you help your child conquer his or her fears, you and your family can expect the quality of your lives to improve. Of course, I can't predict the degree of this change. Some parents will see their child freed from anxiety. Others will make moderate progress, seeing a greater sense of mastery over anxiety symptoms in their child. Yet others will learn from this book about the kind of help their child may need and, with that information, can make sound, educated decisions about which treatment options to pursue for their child. Regardless of which of these best describes your experience, I can promise you will gain knowledge and learn strategies that will move your child closer toward conquering his or her fears. How to use this book? I suggest that you listen to the chapters of this book in order. I have organized them to help you work through the CBT program in the smoothest and most effective way. This is the order I use when working with patients. The basic knowledge and tools you will need are introduced in the first 3 chapters. The strategies described in the following chapters build upon one another. If you jump ahead, you may not learn a skill or have some information you need to implement the next step. Throughout the process, you and your child will be completing a series of worksheets. I have included examples of completed worksheets in the book. Blank worksheets can be downloaded from the publisher's website, www.newharbinger.com/39539. You can also find short videos on my website, www.drbridgetwalker.com, that illustrate the kinds of conversations you will have with your child. In my experience, parents who participate actively and complete the worksheets are more successful in helping their child and less likely to engage emotionally in their child's anxiety than are parents who do not. Even if you think you're too busy, I recommend making the time. Devoting just 5 to 10 minutes a day to collecting information about behaviors, for example, will pay dividends in the future as you and your child learn to deal with anxiety more effectively. I recommend listening through the book in its entirety before sharing it with your child. You are the leader in this process. If you have a good sense of your goals at each stage and how the work at one stage will help your work at the next, you will be a more effective leader. The program in this book is designed for children of all ages. I have used it successfully with young children as well as teenagers. That said, you may need to make adaptations depending on the age of your child. For example, you could ask an older child to listen to the book himself or herself. You will also have to identify the most age-appropriate examples as you develop your own lists of situations, targets, exposures, and rewards. You know better than anyone else how your child thinks, what he or she likes and dislikes, and how he or she learns. If you keep this in mind as you work through the program, you will have greater success in alleviating the debilitating effects anxiety exerts on your child. Chapter 1. Educate yourself and your child about anxiety. If you picked up this book, you probably are concerned about your child's well-being and may suspect that anxiety plays a role in your child's suffering. Anxiety can be tough to detect because children who suffer from anxiety problems often do not seem overtly anxious or fearful. Understanding how anxiety appears and how it operates will help you take the first steps toward helping your child. Anxiety problems can show up in children in a myriad ways. Many parents are baffled by the irrational and exaggerated nature of their child's concerns. Why does Mark habitually believe he's going to bomb his math test in spite of his stellar performances? Why does Tamika insist I reassure her that the doors are locked and the alarm is on, even though she knows we live in a safe environment and practice reasonable security precautions every night? How come Francis throws a fit when he can't understand a new concept in science he logically can't be expected to have down yet? Why does Allegra tell me on a daily basis that kids think she's not very smart or funny when she is one of the more popular children in her class? Essentially, why doesn't my child understand reason? Why doesn't she realize that nothing as bad as she predicts ever happens? In other words, why doesn't he learn that his fears are unfounded or greatly exaggerated? I will do my best to answer these questions in this book. It can be heartbreaking to watch your child struggle with worries that interfere with her activities. Anxiety problems exact tremendous costs on both the sufferer and his or her loved ones. Navigating daily life can be exhausting, contentious, and stressful. In this book, I tell you what you need to know about anxiety and how to take concrete steps to help your child conquer his or her anxiety. The nature of anxiety. Many scientists believe anxiety disorders are caused not by the mere presence of fear, but by attempts to escape or control the uncomfortable sensations and thoughts that accompany anxiety, such as a rapid heartbeat or unwanted recurrent thought. These tactics are referred to as avoidance and safety behaviors, and in the case of obsessive-compulsive disorder, rituals. And they typically give anxious individuals short-term relief from anxiety-related distress. The problem is that reliance on these behaviors fuels anxiety over the long term and prevents children from learning that their expectations of dire consequences aren't accurate. This pattern keeps your child trapped in the clutches of anxiety. Attempts to avoid, suppress, or escape discomfort are often what the parents or teachers of an anxious child notice first. Anxiety can appear as overt worry or fear, accompanied by clear physical signs such as hyperventilation, shaking, and terror. It also often appears as shyness, sensitivity, clinginess, rigidity, quirkiness, oppositionality, low self-confidence, pessimism, indecision, procrastination, and anger. As you can see from Table 1 in the supplemental content, most signs of anxiety are not so obvious. Although the signs may differ, the basic nature of anxiety is the same. Deep down, an anxious child fears being in a particular situation he or she believes will result in a negative consequence. The source of your child's anxiety may not be obvious to you now, but as you listen to this book, you will learn how to pinpoint what your child fears. For example, Tom fears going to soccer practice, where he worries an unleashed dog might bite him. His symptoms include a nervous stomach and nausea before practice, and he consistently tells his parents that he just doesn't feel well enough to go. Alicia fears taking tests at school because she worries about getting a less-than-perfect grade. Her symptoms are less obvious than Tom's. She avoids raising her hand in class in case she gives a wrong answer, and she refuses to participate in any after-school activities that might prevent her from studying. As a parent, you may observe less obvious signs of avoidance, suppression, and escape behaviors rather than overt anxiety. The important thing to remember is that the underlying nature of anxiety is the same, regardless of how you see it affecting your child, and you will follow the same program to help him or her. Anxiety disorders are common in children. Anxiety disorders are the most common type of psychological problem children experience. 1 in 8 children suffers from a significant anxiety disorder. This means that in an average class of school-aged children, 3 will suffer from some type of anxiety symptoms that cause significant distress, interfere with their ability to engage in typical activities, or both. Symptoms can emerge in children as young as 4 or 5, although you may notice symptoms even earlier. Because anxiety can show itself in less than obvious ways, many parents are unaware that anxiety is at the root of their child's symptoms or behaviors. As a result, the parents and even a pediatrician or mental health professional may dismiss the symptoms as developmentally normal or just a stage. They may think a child is just shy or overtired or has an attention deficit disorder. Because a young child can't clarify what is happening, and because many mental health professionals are not adequately trained to assess and treat anxiety disorders, it may be years before a correct diagnosis is made and a helpful treatment is found. Even though parents may not be able to recognize that a child is suffering from anxiety, in my experience, they know their child and know when something feels wrong. My advice is to trust your instincts. If you suspect your child's anxiety adversely affects his or her day-to-day activities, please use this book as a resource and a guide. I will show you how to take concrete steps to improve your child's life. The effects of anxiety. For starters, is anxiety such a bad thing? In actuality, some degree of anxiety is a normal part of any healthy person's life. Mother Nature equipped us with the fight-or-flight response to help us protect ourselves in dangerous situations. We have a choice between facing a threat, if we think we can overcome it, or fleeing from it, if we are afraid we can't win. In that case, acting out of fear, in the interest of safety, is a legitimate option. Anxiety can also prove helpful by heightening our performance. All other things being equal, fear of coming in last or losing a game can drive an athlete to perform better than will a less motivated competitor. Similarly, a student who is a little worried can perform better on a standardized test at school than can a student who couldn't care less about the results. Often, however, anxiety can grow to the point where, instead of serving us, it becomes harmful to our well-being. This is true of adults as well as children. Not surprisingly, many adults with anxiety problems have endured symptoms since childhood. Anxiety is considered unhealthy if it keeps a child from living a normal life at home, with friends, and at school. Your child may avoid situations, such as going to public bathrooms, speaking up in class, or being near animals, that spark anxious feelings. Doing this over time tends to increase those fears and eventually impedes healthy psychosocial development and quality of life. Because anxiety symptoms can be masked, children with anxiety disorders often function well in terms of grades, achievement, and more, yet live a tortured internal life rife with worry, fear, or excessive guilt or feelings of responsibility. Over time, high levels of distress and anxiety are mentally and physically exhausting and demoralizing, and a child can become depressed and hopeless about the relentless nature of severe anxiety. In fact, a large body of research tells us that untreated anxiety disorders markedly compromise the quality of life and psychosocial functioning of sufferers. Why is it important to help your child now? Research tells us that if we don't adequately treat children with anxiety disorders, they are more likely to develop other mental illnesses in adulthood, such as depression and substance abuse. Furthermore, studies indicate that most anxiety symptoms are chronic. Children usually do not simply grow out of them. Unfortunately, the tendency for anxiety to come and go leads parents to believe it will eventually go away once and for all, and so they are disinclined to seek treatment for their child. Another important reason to help your child conquer anxiety is to prevent it from seemingly becoming integrated into his or her personality. Anxiety is not a personality trait or style and does not define a person. Personality does not change much over a lifespan, but anxiety symptoms can and do. Not only are anxiety disorders the most common mental health issue, but they are also one of the most treatable. I have seen countless children and adults transformed when their anxiety is treated effectively with CBT. How anxiety operates in your child. Before we discuss treatment more, let's look more specifically at how anxiety operates, including the role of family history, the functioning of the brain, and patterns of anxiety. The role of family history. A family history of anxiety issues predisposes a child to such disorders.
Sample complete. Ready to continue?